Good morning. Welcome everyone to our event on SDG 5 during a time of crisis of COVID-19. I am Izabela. I am the program manager of Open Gov Hub, and I'd like to welcome you all and thank you for taking the time this morning or this evening to join us. Before we start, I will give you a really quick snapshot about Open Gov Hub and then let everyone introduce themselves. We are located in Washington, D.C. We're a co-working space and a network of 50 organizations that work on transparency, accountability, and civic participation. And as fun facts, I am currently in Norwich, Connecticut. I'm originally from Warsaw, Poland, and I identify as a night owl. So this isn't the best time, but we're gonna make it fun. So I am gonna be the co-moderator today with Radhika from CoRE, and I'll let her introduce herself.
Hi all, namaste to all the Indians and hi to all those people who have joined us. I'm Radhika Ralhan. I'm a program management fellow for Collaborating for Resilience in Washington, DC, originally from Delhi, India. I am a night owl and I have with me Blake Ratner, who heads CoRE and who will be able to tell you more about what we do.
Thank you, Radhika. Blake Ratner. I founded Collaborating for Resilience as an organization that is focused on promoting multi-stakeholder dialogue to address the roots of conflict and competition over natural resources and build resilient livelihoods. We work in Asia, Africa, and South America. And I'm especially pleased to join today with such a wonderful international group. I'm a morning person, so a morning lark, and glad to be joining at this hour. Thanks.
Thanks, Blake. Ankita, could you please introduce yourself?
Good morning and good evening. Namaste to everyone here. Thank you for making the time to join us here on this very important issue. I'm Ankita Mookherjee. I'm an assistant professor with the West Bengal College Service Commission in India. I am from Calcutta, West Bengal, and I've studied in Delhi. I think it's an ice-breaking question, and I think I definitely identify myself as a night owl. So that's me, and I really look forward to this panel.
Thank you, Ankita. Praveen, could you please say hello to everyone?
Namaste, everyone. My name is Praveen Karn. I work for an organization called Spark Minda Group, which is an automobile manufacturing company. I head the CSR, Corporate Social Responsibility vertical for this group. I'm working in development sector for the last 15 years. I've studied rural development from Xavier Institute of Social Services. Well, I love working, whether that's morning, that's night, whatever time is that. If there's a need, I love to work. It's glad to meet all of you here in this platform. Thank you. Thank you, Izabela.
Thank you. And just to make the categories even more fun, you can be a night owl, morning lark, or a perpetually tired pigeon. So that is totally a thing. Thank you so much. Deirdre, could you please say hello to everyone too?
Good morning, good afternoon, good evening, everyone. My name is Deirdre Appel from Open Data Watch. We are an international organization based out of Washington, D.C. that focuses on improving the use and quality of official statistics for achieving the SDGs with a strong focus on gender data. I am currently based in New York City, though I'm from New Jersey. And I would say with the right cup of coffee, I'm a morning lark.
Thank you. I think coffee goes a long way for all of us. Thank you. Leanne, could you please introduce yourself?
Yes. Hello, everyone. My name is Leanne Brotsky. I'm with the DC Coalition Against Domestic Violence. We are the federally recognized state coalition of domestic violence service providers here in Washington, DC. We work with about 15 different organizations that serve survivors of gender-based and domestic violence across the city. I am here in Washington, D.C. right now. I'm originally from California, and on either coast, I am a morning person, a morning lark as well. So this timing works nicely for me. I'm very excited to meet all of you.
Thank you. I'm glad this time works for you too. Nice. So we have two more panelists to say hello to us. Rishi, could you say hi and introduce yourself to everyone, please?
Hello, everyone. This is Rishi. I'm from Bangalore. I work with supply chain sustainability. So my work has mostly been been with farms and factories and looking at human rights of rights holders who are there at the bottom of the pyramid. Also, I want to wish all of you, the very best of health, and please stay safe. We are going through very extraordinary times, and I hope we'll be out of this epidemic very soon. I would say I'm both actually a morning and an evening person, but these days, there is no routine to the day as we are working at home and things are very extraordinary. So I'm just taking every day as it comes and trying to break old patterns. Looking forward to interacting with all of you.
Thank you so much. And last but not least, Suruchi, could you please say hello to everyone from space?
Thank you so much, Izabela. Hello, everyone. I'm Suruchi Aggarwal. I'm the National Coordinator for SDG Philanthropy Platform and Business Human Rights Project. I work with UNDP in India. Presently, I'm based in New Delhi and also work in New Delhi. And regarding being a night owl or a morning lark, I would say I would change every now and then according to this situation as it demands. And of course, with the present situation that we are at, we need to be very dynamic. So I'm very flexible for that. Thank you.
Thank you so much. All right, so this is everybody. And just to get us started, we're gonna do a quick poll with the audience. So this is loosely based on the SDG targets for number 5 on gender equality. The opening question, and we can go in order to answer that. And Blake, you're first on my window, so I'll ask you first. So what are the top 2 or 3 critical challenges that the world is facing in addressing gender equality as far as policy goes, that is especially exacerbated now during the COVID-19 crisis?
Well, I think I take a particular perspective coming from the arena of environment and rural livelihoods. And so, my comments are going to focus on that aspect. I think that the top concern from my perspective really is about the strain on people's ability to feed their families and to provide for themselves. So food security and livelihoods, and what that means in particular for women's roles, those who in more marginalized rural communities might be especially at risk. But the other dimension I think that I would like to highlight is the one actually that came out lowest on the poll we just did now, which is about political voice. Because just as climate change is a slow-moving but very severe risk to the future, I think what this shows, the pandemic, is that it's the kind of thing that is so much more affordable to address in advance, in a preventive measure, as opposed to these kind of drastic remedial measures that we're seeing that have such deep economic consequences. And so I think that just puts an emphasis on the ability of society to influence policy, and in this case, particularly the ability of women's voices to speak to the priorities that are most of concern to them, and to have those influence the policy agenda so that we're not so deeply at risk to these kinds of threats.
Absolutely, thank you. Especially from also the perspective of most Open Gov Hub groups, policy that is the underlying problem of a lot of these issues is often forgotten, but it is a systemic and structural challenge. So yeah, thank you for your answer. Deirdre, could you please give some insights from ODW?
Sure, absolutely. And I think I liked how Blake started it with where his perspective's coming from. For Open Data Watch, we work across different policy domains, but the one underlying theme across all of them is that for, successful policies, data is a critical input for them. And so right now we're seeing that COVID cases have exceeded 2 million worldwide, but that only tells us part of the story. And without, better disaggregated data on, sex and beyond just infection rates, and how women are being affected by the pandemic is really a challenge right now. And more specifically, one of the challenges within that area is ensuring the continued collection of gender data to inform our policy decisions. So we work very closely with national statistics offices around the world, which are and have been a major stakeholder in providing the gender data for SDG 5 and SDGs more broadly. So you think of their work with the census, household surveys, labor force surveys, violence against women surveys, et cetera. Right now, we see a lot of industries struggling, but those government offices in particularly needing to adapt to a wide range of new challenges in some cases, government departments that were already under-resourced or over capacity in normal circumstances. Now, additional challenges of working from home, mobility constraints, even, needing to move from face-to-face survey data collection to remote or online or telephone. All of this is having a really big impact on the current and ongoing data collection efforts, which provides us with the information on women and girls that we need to make the right policies. So I think right now, that's the major challenge we're seeing from where we sit. And fortunately, there's a lot of good examples and good practices that we can discuss in the breakouts and perhaps in the next round of discussions on how NSOs are coping with this.
Thank you, Deirdre. I have to go back to my other view, but Suruchi, could you give us some insights from UNDP India and how you're feeling and what you are aiming to do in regards to COVID-19 and gender equality?
Sure. Thank you, Izabela. I would in fact say most of the points that we feel from our end have already been covered in the survey. And it's always the women's economic and productive lives which are quite disproportionately affected when such sort of pandemics arise. The main reason over here we would say is because women earn less, they save less, they have less secure jobs, and they're more likely to be employed in the informal sector. We also see a large number of single-parent households, and hence the social protection schemes are actually not adhering to their particular standards that they are supposed to be. I would also say from my previous experiences, because UNDP has actually worked across the globe during pandemic situations, and Ebola and Zika, like all of us are aware of, and experiences from such pandemics tell us that we tend to overlook the vulnerable and marginalized Sorry?
It's okay.
We tend to overlook the vulnerable and marginalized people while we are trying to address issues, while we are trying to manage crisis. So another significant thing which the Ebola virus has showed us, it was that related to quarantines, where at the quarantine homes we saw that women were significantly they were more vulnerable, and there was reduction in women's economic and livelihood activities because of quarantines. There was increase in the poverty rates, and there was exacerbating food insecurity. At the other hand, we also saw while these pandemics were up and running, that men's economic activity returned to the pre-crisis activity levels soon after the pandemic was gone, or once the preventive measures were all in place. So it's from our previous experiences also that we have seen that women's jobs disappear, that women are also under low paid employment. They are more into unpaid care work, and the sort of vulnerabilities increases exponentially. And this is also actually a very major hindrance to the SDGs. And we are trying to sort of come up with policies and programs and working with all the governments across the world so that we can come out of this crisis, especially from a gendered lens. Thank you.
Thank you so much, Suruchi. And Rishi, could you give us an answer to the question of what are the most pressing issues of gender equality during this crisis?
Sure, I'll give it a try, because in this whole epidemic, communication has been a challenge, and we are dependent on hearing stories from our friends in the field on what really is happening. And there's a lot of over exaggeration in the media, so sometimes we don't know what is really happening on the ground. So, but I'll just focus my comments on the supply chain, on the business side, and the organized sector, and just try to share what I've been hearing from people in our network. And obviously, there are some sectors which have been very badly impacted, and which also had a very big women participation in the workforce. Garment and apparel, for example, is one sector in India where majority of workers are women, and so the factory shutdown is obviously affecting a lot of worker groups, and in turn affecting a lot of women. Also, things like basic healthcare. As we know, India is a country where basic healthcare has been a challenge, and so it is not reached out to, I would say, people at the the rights holders, or people at the bottom of the pyramid. So that remains a challenge. I also see a lot of challenge when things will open up, and there's a lot of word going out. Factories will open up, business will open up. It sounds very easy to do, and I think the big challenge in bringing business back online. The biggest challenge will be about working hours, about wages, and we've been talking about wage parity between men and women for decades, and I think we are just going back in time in terms of what's going to happen. Uh, Wages might decline. Also about hiring, when you want to bring people back to work, there are all indicators that women will be left behind, and the situation of coming out of the home to the workplace might not be ideal. There might be more screenings, health screening. There might be lack of support to children, and also to women. So it seems like there will be a challenge. I also see a challenge on the entrepreneurship level. Many women in India are entrepreneurs, and they are basically sitting at home right now because businesses are shut down. There is no finance kind of support system being provided by the government to the small and medium enterprises. So I think women are right now, uh, being negatively impacted in many ways, whether it's at a worker level, or it's at a white collar job, or at an entrepreneurship level. And I think what is being missed out is looking at the children's side as well, because the rights of women and rights of children are so intertwined. And how do we create those support structures in the society, in the communities, and also at workplace when workplace opens up. So it's a lot of knee-jerk reaction, I would say, in what is happening. People have not started looking at things holistically. Everybody wants to open up businesses again. And I think the conversation is not really happening on when things open up, then what? Then what will really happen? So I think we're just seeing the tip of the iceberg here in terms of what we have seen, the immediate impacts. I think when things will open up again, there's going to be many more challenges coming our way to mainstream people, and unemployment will be very high. So I think there are all possibilities that women will be on the receiving end of all these negative impacts.
Thank you. That is very insightful, and indeed hits a lot of the points that have been vocalized by agencies like UN Women. So all of you touched upon all of them. They actually have a policy brief that came out on April 9th, and they are saying exactly that. This is the international community is underlying that all the progress that has been made, and especially, ironically so, in the decade of action can be rolled back because there are compounded economic impacts. The fact that health is not, like, even though men are statistically a little bit more affected by COVID-19, resources for family planning and reproductive health are being rerouted, and a lot of the other resources for things like domestic violence are also being rerouted. There's a rise in gender-based violence because people are on lockdown, and unpaid care work has increased as well. And generally speaking, women do hold more vulnerable jobs than men. So all of these issues are very compounded. So thank you for your insights.
Yes, please. So Sam is my colleague from CoRE, and Sam also speaks Hindi very well. He spends his 2 years in Nagaland.
I don't speak. I speak a little bit.
I told you.
I'm able to. I'm recording, or it should be recording right now.
Fantastic, Sam. Thank you so much. A very warm welcome to all of you. I have a really, exciting panel with us. We have already done the introductions of Praveen, Ankita, and Leanne. And the idea of the breakout room is that I'm going to ask in a leading question to seek quick perspectives. And since we are small here, we can also get into at least 1 or 2 questions. We also relaunch a poll. We take another question. The idea here is then move into a group exercise to gain key insights. After the breakout room, we move into the main session, and then we can share these critical insights and so on. So does that sound okay to everyone? And I hope we can move. Honestly, I like smaller groups. It's easier to gain meaningful conversations and so on. So yes, thank you so much, Praveen. So I have, we are at a very critical time here, that while the crisis is increasing in terms of health and in terms of, the overall, testing the humanity, but simultaneously, we also see a rise in domestic violence cases. In fact, the everyday violence cases against women, statistics. And in that context, given the lockdown that has intensified this everyday violence against those women and girls who are already becoming more isolated than before, my first question would be, how would now this violence will be observed, or what is the trajectory that it will take in the public and private spheres in your context? Because this is at a very interesting, phase that we are in. Earlier, there was street violence, and yes, there were private sphere violence. But now with the lockdown, how is this being perceived? And Leanne, we can begin with you and your thoughts on it.
Yeah, absolutely. So, I think, as you said, first and foremost, what we see is that domestic violence, intimate partner violence, or violence against women in the home is severely increased across the board, especially as people are sheltering in place or under stay-at-home orders and are spending larger amounts of time with abusive partners. Violence goes up. We know that this happens typically sort of in any kind of global crisis that requires, more time at home. In this particular case, I think especially for our programs who are on the ground working with survivors every day, a few sort of COVID-specific things we've seen. We've actually started to see sort of the fear of COVID used sort of almost as a form of abuse and power and control. So looking at abusive partners trying to prevent their partner, their wife or spouse from receiving medical care when they're experiencing COVID symptoms, trying to say they're not allowed to leave or sort of have access to additional resources in case the fear of sort of COVID in the home is increased, not allowing them to sort of spend significant time with children in the home, quote unquote, for the risk of exposure. So we're seeing it sort of even as an abuse tactic itself. And then I think the other piece that we're seeing is that in this time, it becomes exponentially more difficult for survivors to connect with services. So across the US, I think how people are accessing resources looks really different. Calls to domestic violence hotlines or law enforcement agencies are either flat or down, because we know that survivors, when they're in the home, may not have a safe moment to actually call and reach out for help. But for survivors who are connected with domestic violence programs, we've seen those calls increase exponentially. And rather than spend perhaps a few minutes on a phone with a survivor for a brief question, these calls are now taking, sometimes a few hours, as we're doing more extensive safety planning about how to stay safe sort of in this new reality. So we've certainly seen a lot of shifts, and we know, unfortunately, as this continues, it's likely to continue increasing along this trajectory.
Thanks, Leanne. That's very important. And, in the Indian context, while in DC we have these hotlines, we have the calls, we also have them in the Indian context, but this is also shedding the light in how the usual, measures that the state had taken up and how it's being either intensified or, like you're saying, it has fallen completely flat because there is no room for women to actually speak, then, and it really poses a very pertinent question. Ankita, I will bring you into this discussion now. What do you have to share your lights on, this whole, aspect that Leanne was talking about, and especially in the Indian context?
Well, I think I would definitely also like to focus on violence in the public sphere, along with domestic violence. I mean, undoubtedly, and I think both of them need to be addressed. Essentially, now the only way of connecting to the world outside because of COVID is the virtual space. And there have been reports now by ICPF, which works for child rights in India, about how there is an increased demand just in 1 week of March 2020 for child pornography. And it doesn't, take too long for us to estimate that this is obviously going to lead to more violent demand for more violent content, which puts women certainly at risk here for, as people who might be very, very prone and susceptible to this. And of course, when you look at the issues of violence in the public sphere, one needs to absolutely keep in mind how there is a class dimension to it. Vis-a-vis the middle class women in India who are now within their households, and of course are experiencing a different form of violence, and which is why there's a rise in domestic violence numbers. There are the migrant laborers who are at a very high risk. And that's because high risk, not only because of the disease, but also the kind of lack of shelter, lack of house, and lack of transportation, which is constantly putting them at a very high risk. And in fact, one of the cases that came in, which was reported, and it is no surprise that a lot of these cases are not being reported at this moment. But there was in Gaya in Bihar a case of rape, a woman being raped, a migrant woman being raped while she was in the isolation ward. So while we need to address issues of domestic violence, I think these are also very special challenges which COVID has put forth. Also with regard to the healthcare workers, and I think we all understand that caregiving and almost I think 70% of global healthcare workers are women. Well, ICMR is talking about rights to protective gears for all medical practitioners, but with women health workers, there is also the question of safety, security, for them to stay back at work. All of these are areas which need an intervention if we want to contain violence in the face of COVID. I think, when it comes to the whole idea of domestic violence, there's a very, very surprising issue at hand in India, particularly, which is how the government has, disabled some sections of what we call the prenatal, sex determination test. They have, we have that act in place in India so that there is no sex selective abortion. But I want to flag off this issue that till I think about June 30th, very significant portions and sections of this PCPNDT Act of 96 has been disabled. And I think a lot of organizations which work for women don't see much point in that, and one needs to address why that's happening. And of course, going back to what Leanne had to say, I think it's an extremely important issue that how does one actually connect with the agencies that are there to provide support in the face of domestic violence, how do women actually get that space? I think that's a very critical question, because we have the National Commission of Women having set up a WhatsApp number for Indian women who are facing abuse to connect to. But do they actually have that space? So all of these questions need to come. And I will just end with one more concern, which I do have, which is the whole idea of unpaid care work. And I see that as a form of violence too. So I think that needs to be taken on board, and I would be very happy to talk to you all about that in this panel, because I think that is also a big way of perpetuating violence against women. So that's from my end.
Yeah. No, thanks, Ankita, for I think in a very brief time, touching all the contours of the spheres of violence. And definitely, with the agency's response, that's something I will definitely come back to the second question when it comes to taking up immediate measures. While we were talking about the violence in the private sphere or in the public sphere, I also feel that it's how will the workplace violence, or also in the rural context that you had stated, like Leanne, and you are talking about the household, like the per household characteristics of the violence, where you have a hotline. At least you have that access, you're not using that, but you have that access. But I want to immediately bring Praveen into it. What is the workplace violence that also is another space itself? And definitely, how will that shape up? And through your social responsibility programs that you have been carrying out in the rural parts of India, working closely with rural women, how is the violence being perceived in that context from both the private sector and even as the workplace context?
Thank you, Radhika. And to respond to your question, I'd like to categorize my response to your question in 4 different heads. I'll take the reference of some of the facts and the statistics first. Then I'll also like to talk about the vulnerable groups in this situation. Third, I'd like to talk a little bit about the accessibilities and the rights which should be there, which is not there to truly observe. And lastly, I'll be speaking about the situation right today. To start with, in this unprecedented situation, which is going to be very, very extraordinary, the world is facing this situation first time ever. So the responses are really difficult, and they are strange. If you look at the facts, first of all, we actually do not have the facts and the statistics available. I would like to talk in Indian context, first of all, Radhika. We don't have much of the agencies today who are allowed to go and to collect the data and the facts and the figures. That's one of the situations. And whatever we are trying to talk today, these are all based on mostly on assumptions, hypothesis, and we are assuming that this would be the situation. I tried to find out some of the stats. I found 92,000 calls for the child abuse have been received in India during COVID situation. That's a big number. It's a very, very big number. ARRE has given this report. I could find another stats here. National Commission of Women is saying that the domestic violence cases have doubled during COVID-19 situation. So a couple of certainly alarming facts. Now, the vulnerable groups. In India, the food accessibility, which is being ensured by Government of India, which is truly appreciable through PDS, Public Distribution System, is there. It's available for persons with having below poverty line cards, or those who belong to marginal sections of the society, ultra poor section of the society. There's a lot who do not have this PDS accessibility. How are they staying today is a question. The migrant workers who moved from Delhi or Mumbai tried to go to their native places. How have they faced the situation? We knew about Nizamuddin, what has happened out there in the railway station. And there were women, there were children along with them. And what has happened out there, we do not know. We don't have those facts readily available. We are assuming there would be issues. Another vulnerable group, persons with disability, and majorly the women with disability. How are they able to sustain their lives in this difficult situation? What is reaching to them? I'm in touch with many of them with my organization's working for persons with disability. They were not having access to food, which we ensured in Delhi NCR, in the homes where these persons with disabilities are there. And the women out of them are most vulnerable. Sex workers, transgenders, are we thinking about them? The domestic help, who have been discontinued by many of us, that you are no more in work with us, therefore they would not be getting their wages. How are they going to sustain? Women in the tribal states of India who are working in brick manufacturing, they are not working today. The contractors are not paying them anything today. 84% of the women in rural India are dependent on agriculture and allied activities. With COVID 1.0, all these activities were stopped. They were earning on daily basis, they were sustaining on daily basis. Are they really sustaining today? Where are they? What are they doing? Women with thalassemia, they require blood on frequent basis. There's an acute shortage of blood in India today. How are they sustaining? 30% of the industrial workforce are women. Many of them have moved from the workplaces, they have gone to their native, and many of them are yet there with them. Are these industries, are these organizations giving an access of the basic requirements to them? That's another question. The child homes, the old age home, the widow healthcare, the slum, Dharavi, we heard about Mumbai, what is happening out there. So these are the vulnerable groups which comes to my mind, and I'm not able to get a right answer for them, Radhika. I also think about the accessibilities. Think about the right of sanitation for the women. We work for the women for their menstrual hygiene, family planning, reproductive health. Are these basic necessities reaching to them majorly in rural parts of the country or not? Is the right of sanitation being practiced today for them? I talk to some of my friends who are persons with different types of disability. They are not able to access those online portals for getting their ration and things like that, because these portals are not accessible to them. Person with visual impairment cannot place an order through these portals. Think about the accessibility. Think about the stigma which is related to the COVID-19 people and their families. They're been purposefully been isolated, not only by the government for the obvious reasons, but also by their nearby people. They feel that they have a stigma with them. Look at education. Education, Radhika, we have the online portals on which schools are offering education in the metropolitan cities, but this facility cannot be ensured in rural parts of India. So Ankita just talked about the safety of women in isolation ward. What happened in Gaya in Bihar? So look at this story. I also heard that the female health workers are being attacked in various parts of my country. I feel bad, very bad about it. The right for other health services, which is badly been compromised. You would have seen a viral video recently. A lady was carrying the dead body of his son, who died in an inaccessibility of health services. So these all alarming questions are there in my mind. I do not feel very good talking about all of them, but yes, this has happened. This is happening in my country, and I'm assuming that this would be happening in many other parts of the world as well, to answer to your question, Radhika. Thank you.
No, Praveen, thanks so much for outlining this. And through all the discussions, I have outlined 4 critical areas that emerged. One is, what is the characteristics of the group within the women and girls that we are speaking about? Differently abled groups, vulnerable, rural, working women, health professionals who are already nurses, and we have seen all those cases. So what are the characteristics of group? We cannot just limit this into, like Ankita and Leanne were saying, middle class households. Then the most important part is the economic repercussions, the first jobs that were being laid off. And I can speak, and I think Leanne can bring the DC, the US context here, DC Coalition for Women context here, that women were the first one to leave. They were laid off. the third is within that context, in the private spheres, the workload increases for women. You know, they're already working, those who are working, ongoing workers, and they're already doing the household and other jobs. So there's an increase. And I do see that also as a form of workplace or the violence. The other is the isolation and the whole context of accessibility. Already there are inaccessible services that are, you know, there, but they're completely inaccessible. We did the menstrual hygiene program in the villages of Rajasthan. What is happening? What are the implications? I want to bring in, I think, Sam, if we do not have poll right now, which is good in a way, I want to bring two quick questions from the audience. If you can just, you know, unmute yourself or just put it on chat that you want to raise two quick questions, because we also have an exercise here. Anyone from the audience or even a comment that you would like to bring into the picture. Anyone? Sanmita, would you like to come in? You can unmute yourself. Just unmute yourself.
Hi, everyone. Sanmita here from Mumbai. This has been happening since December, Jan, right? And this issue of gender parity has been there forever. And so many professionals here, what are some of the areas that the pandemic has highlighted in a way that we can reach out through technology faster? And what are some of the areas that have become black holes with loss of access? Has this pandemic, just like in every other business sector, thrown up some learnings for gender parity in your experience in different countries?
Thank you, Sanmita. Thank you. You can unmute. Thank you. Very valid question. Leanne, I would like to have your thoughts, even the convergence of the other panelists, what they had talked about. Quick thoughts.
Yeah, absolutely. So I'll start, I think, sort of with that loss of access piece. I think what we are seeing here is that often in the move to digital, the populations that Praveen and Ankita had talked about are often forgotten, of thinking about who does not have that internet access, or if we are putting out information about how to get services or contact phone numbers to call, chat services that you know, increase access and potentially are easier for someone to text or to talk about, you know, more quietly when they're in the home or in the community with abusive people around them. I think what we're losing most is who doesn't have that access. And that's been sort of a big question and struggle, both in the DC government and sort of as we talk with our sister coalitions across the country in the US, to really make sure that those that don't have internet access, who might be going out in the community, who might be going to these essential locations, still have access to this information. And I think in the quick move to move everything digital, which has given a lot more access in some ways, the conversation around who does not have access, who are in those rural communities without broadband or without internet access, who are not able to afford, who may not have access to devices or technology in the home, even if it's available in the home. Women typically, you know, are the first to lose access to that in abusive situations. So I think that is certainly a place where we need to be having larger conversations around how, in this rapidly evolving technology world where we're being pushed further into using technology, what happens to those that don't have that access?
Sure. Ankita, very quick thoughts, because we also have an exercise to do.
Yeah, I actually completely agree with Leanne, and I really thank Sanmita for the question. I think it needs more discussion. It needs to be thought through more. But I think with a couple of things in hand, for example, we now have healthcare apps. We have education, which is being transmitted through online platforms. You know, we have grocery apps, you know. We also have work from home for women, which actually, yes, while disbalancing gender roles in household has been difficult for women to cope with, but certainly has also added, because it makes the employers more comfortable with this kind of an arrangement. So yeah, I mean, the question needs to be thought through more. That would be my comment. But yes, we have been able to use technology well to reach out through some of these, and also identifying what are the essential services. I think that has been this has been a great opportunity to do.
Thank you all. I think with CARE, I think we can leave on that note, Isa, that to bring CARE into the policy sphere in order to bring resilience, it's very, very important to understand the diverse stakeholders' perspective, because the statistics, I am sure when they will emerge, it will be really, really difficult to digest. Already the statistics are out there. The UN Women has already estimated that $1.5 trillion, US trillion dollars, is the global cost, for combating this violence against women. And this is actually going to increase. And countries need to adopt action plan, which actually, address or mitigate the gender crisis, because both are going in tandem with each other. The global health crisis in parallel, in tandem with the gender crisis. Isa.
Absolutely. Thank you. Yeah, so we're almost at time. We have 1 minute. So I wanted to echo what was said in this room and what UN Women is actually suggesting as policy initiatives, is to make sure that women are represented in the response planning and decision making, that we target women and girls in all efforts to address the socioeconomic impacts of COVID-19, and that we keep driving the transformative change for equality, especially with addressing the paid and unpaid care work. And honestly, just treating each other as good human beings.